Dr. Alva, I'm doing extremely well today, and I just got a little bit better with you joining me for my guest here in Dallas, Texas. How are you?
I am doing terrific, and you're so kind to say that. Thank you for having me, Valder.
Well, you get to talk to an important topic, about an important topic to a very, very important audience. And I call them important because they were born between 1946 and 1964. They're known as baby boomers. And I told them you would be coming this week, and they had a lot of questions. I don't know if this group is more interested in schizophrenia, or you're going to tell us a little bit about it, though. So can you explain what it is? I'm sorry?
You bet. I certainly can, and I'd be happy to do so. So schizophrenia is a terrible scourge of an illness. It's a chronic, lifelong medical problem in which people sometimes experience positive symptoms, meaning the addition of symptoms like hallucinations. Imagine you not being able to trust what you hear or smell or taste or feel, and delusional thoughts, not knowing whether something's real or not, and feeling like other people are persecuting you or want to hurt you. There are also negative symptoms, meaning the lack of being able to feel pleasure, the lack of being able to communicate appropriately, and cognitive symptoms, such as being indecisive and not remembering things. So there are many ways in which schizophrenia can be viewed, but it's a horrendous illness for the individual that suffers with it.
Dr. Alva, I want my audience to know that you are the medical director of ATP Clinical Research, and you have worked on this for many, many years, as I can understand, and you're one of the country's premier experts on this. So thank you for joining us to talk about this. You know, we haven't heard the word schizophrenia in a long time. We got so many other things, let me tell you.
Yeah. Well, thank you for having me, Valder. And you're right. This is an illness that affects 1% of people in the general population, but it is one of the most disabling medical problems that we have out there. Up to this particular point, you're absolutely right. We've only had medicines called antipsychotics to be able to treat schizophrenia. And sometimes they just don't do the job that they're supposed to do, meaning that people might still experience hallucinations and or delusions. And sometimes they're affected by the side effect profile, because if we block D2 receptors in the brain, we may reduce hallucinations and delusions, but we may cause other problems like irreparable movement problems or metabolic dysfunction in our patients that would then hamper their overall lifespan. So you're right, it's been challenging.
Okay, are there any developments in this treatment? We haven't heard about it, but in the background, have scientists been working on this?
Oh, you bet, Valder. I'm happy that you asked. In fact, I am really happy to be partnering with Bristol Myers Squibb today to be speaking about Cobenfy. Cobenfy is a combination of xanomeline and trospium chloride. This is the first and only FDA-approved medication that helps modulate dopamine through muscarinic agonism, a completely different way of working. In fact, this medicine is not called an antipsychotic. It's called a medicine for adults that suffer with schizophrenia. We know this new medicine works well based on a very robust program that showed its benefit across multiple symptom domains that I just described for your audience. But keep in mind, not everybody will be able to take this medicine if somebody's allergic to the medicine, or if they have certain problems regarding emptying their digestive or bladder tract. If they have certain eye problems or certain liver problems, they would not be able to take the medicine. And remember, all medicines may cause side effects. The most common side effects with Cobenfy could include nausea, constipation, stomach upset, or increases in blood pressure. And that's why it's important for patients or people to speak with their doctors to find out whether they are an appropriate fit for a new medicine or not.
Also, too, you really have to, I think you almost have to be a scientist or a doctor when you take medicine today, or when you have a condition and you take an over-the-counter medication, because you know they got the kind if you got high blood pressure or if you don't. So you have to be very, very careful. So I'm glad you add that warning to this. Let me ask you this. based on your personal experience, how is the innovations of technology, how's it changing care for patients with schizophrenia?
Well, I'm happy you asked. Cobenfy.com is a great resource for people to get more information. What I have seen personally with my patients is that this new medicine offers a step forward for patients that may not have gotten the benefit or may have had intolerable side effects that they didn't like with other medicines that have been extant up to this point. So what I see is that innovation is critical in the medical field, and I'm happy to share that, we have this innovation at our disposal at the present time.
Okay. Well, I've got to let you go, but I've got to take this question from Facebook. My audience is spread out on multiple platforms, and I thought this was a good question. She says she's a caregiver of a relative, and how can you manage the side effects, or how do you manage schizophrenia on a day-to-day basis with someone who has this and is taking medicine, because it wears on the soul?
You're so right, Valder, and I'm glad you asked that, because this is an illness that has a ripple effect. The people that love and procure for the care of somebody that suffers with schizophrenia want the best outcomes for their loved one. And that's why, speaking about innovation, introducing new medicines like Cobenfy can be such an important step forward for people. There's a holistic need for individuals with schizophrenia, and this happens to be one of those components. Again, Cobenfy.com, Cobenfy.com, a great resource for individuals to gather more information.
Dr. Gus Alva, I want to thank you so much for that. You probably helped so many people you and I will probably never know about, but thank you for stopping by the Valder Beebe Show. This is what I do, find great souls like you to talk to my audience. Have a great day.
Thank you, Valder. You do the same.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.